So once again, welcome to my channel, that is Rathore Dialogue. So today I'm going to discuss about the audiology and speech language pathology and the details overview of that. So first I would like to discuss what is audiology. Audiology is the science of hearing, balance and the related disorders. An audiologist is a healthcare professional who identifies, evaluates, diagnoses and manages hearing and balance problems. So main area of audiology is three. First is the hearing assessment, the second is hearing loss management, and third is balance of vestibular disorders. So I would like to come point by point and discuss the things. So hearing assessment is the audiologist perform various tests to determine hearing ability, including like first is pure tone audiometry, second is speech audiometry, third is tympanometry, otocaustics, emissions, that is QAE, OAE, and the brainstem evoked response audiometry, that is BERA or ABR. So this is about the first hearing assessment, and the second is hearing loss management. There are types of hearing losses, like first is the conductive hearing loss, the second is sensorineural hearing loss, or third is the mixed hearing loss. In the management includes hearing aids, cochlear implants, auditory rehabilitation, and the counseling of patients and the families. Now I am going to discuss about the third and the important also, the factor one, the balance and the vestibular disorders. So audiologists also access vertigo, dizziness, balance disorder, inner ear dysfunction. So common patients seen by the audiologist, like basically there are so many types of patients. So basically common patient will be newborn babies requiring hearing screening, children with hearing impairment, elderly people with the age related hearing loss, industrial worker exposed to loud noise. So this kind of those who are working in the big factories and sound is coming up, and the elderly people, those who are in more than 60 or 70 year of age, so age related hearing loss, and because of the sound the exposure is with the factory labor, maybe there is a hearing loss, and patient with the tinnitus, that is the ringing in ears. It's a kind of disease, patients with the tinnitus, that is a ringing in ear. So what is the speech language pathologist? Basically speech therapy is that. The speech language pathology is the study and the treatment of communication and swallowing disorders. The speech language pathology, that is SLP, helps individual improve speech, language, voice, fluency and the feeding swallowing abilities. So major area of speech therapy will be, the first is the speech disorder, the second is the language disorder, third is the fluency disorder, and the fourth is the voice disorder. So I would like to just come up with the first point, the speech disorder, problem producing speech and sound correctly, like example, lisping, mispronunciation of sound, articulation disorders. Now the second is the language disorder, difficulty in understanding or expressing language, like example is delayed language development, poor vocabulary, or difficulty in the forming sentence. This can be one also. The third is the fluency disorder, problem with the flow of speech, like example stuttering in the voice, cluttering in the voice, and the fourth is the voice disorders. So problem with the voice quality, pitch or loudness, example is hoarse voice, vocal nodules and the voice strain. The fifth is swallowing disorders. This is called dysphagia, difficulty swallowing food or liquids. Common patients will be stroke patients, neurological disorders patient, on elderly individual. So I would like to just give some lights on speech and language development in children. A speech therapist commonly work with the children who do not speak by the expected age, have unclear speech, have autism spectrum disorder, have intellectual disabilities, have hearing impairment, and have cleft lip and palate. So who needs speech therapy? Basically that is also question, who needs speech therapy? Children basically. In children, the speech delay, those who are having the speech delay, suppose the kids is more than 7 years old but he is not able to speak properly. autism, it's kind of disease, learning disabilities, hearing impairment, and the cerebral palsy. This is kind of disease, you know. During in age adults also, like first is if any of the patient is having the stroke issue or Parkinson disease or brain injury or voice disorder or swallowing problems. So this is all about the speech and audiology. So in the next video definitely I'm going to give you some more ideas about different type of subject. So if you like the channel, please like and subscribe.